My name is Justin Kelley. I'm an orthopedic surgeon for Firelands Physician Group, and my specialty is orthopedic trauma and reconstructive surgery. My primary hobby is golf. I like to continue to try to be competitive somewhat as I was a younger athlete. And so golf kind of combines that athletic capabilities with outdoor activity. So it's always nice to get out, get some fresh air, and enjoy the weather while we're golfing. Up here in Ohio, it can be a little bit difficult for that to happen sometimes. The 6 months of winter always puts a damper on that. As much as I can, I like to spend as much time with my family as I can outside of the job. My wife is quite busy with her job as well, but we do have a young daughter as well that we spend as much time as possible with. It's been an absolute pleasure going through that experience, having a child and seeing them grow up before our eyes. So orthopedics has always come natural to me. I grew up in a rural town in Alabama. I lived on a farm. My dad did construction growing up, and so I was real familiar with all the instruments that I use today in orthopedic surgery. In my practice, I actually am able to do most everything that we can do at our facility. From joint reconstruction, so hip and knee replacements, even shoulder replacements, to arthroscopic procedures in shoulder and knee, even simple things like carpal tunnels and trigger fingers. I kind of dabble in a little bit of all of those. When it comes to the more specialized trauma aspects or complex fracture surgeries, those are my specialty, but I can still do the general aspects as well. My job at Firelands has been very enjoyable based on the fact that it's such a small hospital. Everybody knows one another. You see, the same people day in, day out. You know everybody's name, everybody knows your name, and everybody works together as partners. It's not a hierarchy, it's not a tiered hospital where you don't talk to somebody that's painting the wall. You know who they are. They could be your patient. Their wife could be your patient, their husband could be your patient, and you know that. So you ask them how they're doing. At larger facilities and larger hospitals, you just don't get that same experience. Orthopedic surgery has become very close to my heart. I see patients and maybe even people on a daily basis that I can look at and see that there's something there that I could help. When a patient comes to me with a complaint, obviously we want to explore that complaint. We want to figure out, what's going on. But at the bottom of this, we're just all people walking around. I'm a person, they're a person. I want to do my best to get them to live their best life, pain-free, normal functioning, and, experience, what they want to do, whether it be playing a sport, walking without pain, getting rid of some kind of symptom that seems to be ailing them from a musculoskeletal standpoint. Sometimes that requires a surgery, sometimes that requires some guidance. And that's my job for both of those. If we can get you better without surgery, that's ideal. If it takes a surgery to get you better, then hopefully that's something I can help with. Every morning I wake up understanding that my day is going to be served helping somebody. Some days those patients are going to get better. Some days it's going to be the start of hopefully a process that gets the patient better. But every day we know that we're going to work with some patient, help them out in their life to get back to a quality of life or a certain activity that's going to make them enjoy their life better. And that tends to help me enjoy mine better.